Okay.
So it's now we are live on YouTube actually right now. Okay. And so Neil, we are going to talk about cerebral or practically vessels, major vessels above our heart. And
Okay.
And that is have some pictures here for us to look at. And but to understand what we are going to talk about, why don't you just describe the vascularization of our brain? Let's just talk a little about that. What vessels do give blood to our brain?
So we have the carotid arteries in the neck. These vessels give blood into the brain through the circle of Willis.
But before carotid artery becomes, go to our brain, we have what is the bifurcation?
The bifurcation of talking about the subclavian and the clavicular arteries and
we talked about the carotid artery already, right? The carotid artery branches in two major vessels, internal carotid and external carotid.
Yes.
And go ahead. What does the external carotid do?
The external carotid takes the blood from. So I'm actually confused about the question. Can you further elaborate?
Let's talk just about general vascularization of our brain.
Okay.
How is our brain vascularized?
The brain is vascularized by arteries and veins that go through this. You're talking about the cerebral arteries?
I'm talking about all the vessels that give blood to our brain. All the arteries.
Vertebral arteries, the common carotid arteries, which can bifurcate into external and internal arteries.
Correct. So there are four vessels that give blood to our brain, correct? Two internal carotids and two vertebral arteries, correct?
Correct.
Let's talk about the internal carotid artery. Okay, so can you describe to us where it comes from and where does it go to?
Yes, I can. So the internal carotid artery, it comes from the bifurcation of the common carotid artery, and it will enter the cranium through, let me think. Is it through the temporal area of the brain?
It's actually let's start with the major thing. So first of all, here, do you see this picture? Let me make it a little bigger. Now, what is the structure that I'm actually right now? Here,
that is the internal carotid artery.
Well, that is actually the common carotid artery. You see the bifurcation there?
I do.
Yeah, that is then there is a bifurcation there, and that bifurcation called the carotid bulb.
Okay.
Something very special about that bulb, where the internal and external carotid artery take off the common carotid artery. Maybe we ask.
I might need some help. I think I'm a little weak on my vasculature. I should call a friend.
Yeah, let's see. Yanal, what is special about the carotid bulb? We call that area carotid bulb, where the internal and external carotid, they bifurcate. It gets a little thicker and bigger, and then it become two arteries go away from that. That has impact on my everyday work because I work around those arteries. Do you want to tell us?
Oh, he's actually an undergraduate student. I would suggest either calling on John or
John. Okay.
Aren't the baroreceptors there?
Baroreceptors, very important, extremely important, meaning that the carotid bulb, as we call it, it has on its vessel some receptors that say how big or small it is. Higher pressure causes it to expand more, and our body actually measures that and then regulates our heart rate and blood pressure based on that. So that is important for what I do, because when I go and do my ACDF, I touch the carotid, I go, if I'm high enough, and you see here, you're in mid-cervical region, you're in the carotid bulb. If you're there and you're manipulating it too much, if I'm manipulating it too much, those receptors, they don't know if it's expanding and manipulate, or they're getting stimulated, or I'm just somebody from outside is pushing on them. You will have a so-called vagal response, actually. Blood pressure and heart rate can drop and so on. So, and then are you guys able to see that there are two vessels are taking off here and here?
Yeah.
That is like a Y, very lazy Y there, correct?
So the baroreceptors are at the center of the bifurcation?
If you look carefully, let me make it bigger. Do you see that this is the carotid? It becomes a little thicker before the two vessels are taking off. Are you able to see that?
Yeah.
That is where the baroreceptors are, or the carotid bulb, okay? So then those two vessels that are taking off, you mentioned that, Neil, are internal and external carotid arteries. Now, and obviously, I'm hoping you see here that a bigger one goes straight up to the base of the skull. Are you able to see that?
I do see that one.
And then the other one make almost a loop, goes around, and doesn't go through the skull. And that's obviously the external carotid artery. So now we have the so-called internal carotid arteries. And we come back to a vertebral artery in a second, okay? Let's just talk about the internal artery. So then I'm just going to go to this picture now. Let me go one more. Here we are. So that internal carotid artery enters the skull. We come back to that, how it enters the skull. What happens then? Who can tell us what happens then? Yeah, maybe John, do you want to tell us when the internal carotid artery comes into our skull, what happens then?
So then, it's going to split off into some smaller branches, but bigger ones are going to be like your anterior cerebral artery and your posterior communicating and your MCA.
Yeah. Well, when it comes in, obviously, you don't need to know the details of that, but as a neurosurgeon, we have to know there are like 7 other smaller vessels they take off directly from the internal carotid artery. They're important for what we do because if you're there and you act in an unfavorable ways, then you get specific kind of deficit from that because they practically give blood to very special areas. But then it actually then makes 2 or 3 big branches. Actually, the 2 definitely branches, and the third one is to some degree can be bigger or smaller and so on. So you talked about the middle cerebral artery, which is a very, very important artery. Okay, what does the middle cerebral artery here? Which one is? I'm going to go up and down, and maybe John, you can tell me where should I go to visualize middle cerebral artery here.
Looks like you're kind of perpendicular to it. Those 2 on the left and right, kind of.
You mean here and here?
Yeah.
Perfect. Yes. And here, right here, where the plus is, let me make it bigger. Right here, you see that little knob?
Yeah.
What is that?
I'm trying to
That is actually internal carotid coming in.
Oh, okay. Yeah.
Yeah, you see that on the other side, it goes directly down. That's why you don't see it in this plane that well. So this is the internal carotid is coming. And then the most major important branch is the middle cerebral artery. And then the other one that goes this direction, almost always present. We call that what?
What's the anterior cerebral artery?
Yes, anterior cerebral artery. And then, as you see, when they come together, they almost touch.
Mhm. They're
Actually,
communicating.
yes, they in vast, I would say probably 80 to 90% of the people, this two anterior cerebral artery, they communicate with each other, and that is whatever they communicate with each other is called by definition what?
The anterior
The-
communicating artery.
Correct. So the part that is often there, but is not that as it's not as often there as the anterior cerebral artery, is a vessel that goes from practically same area to the circulation of the back of the brain. Do you know what I'm talking about? What is that vessel that goes?
The posterior communicating artery.
Perfect, exactly. And there are two of that. There is one anterior communicating artery, and there are two posterior communicating artery. So let me show you this, then we come back and look at the actual patient one more time. So carotid comes in, internal carotid comes in, then you have the middle cerebral artery, you have anterior cerebral artery, which communicate with the anterior communicating artery, and then it continues as anterior cerebral artery that goes to the midline between the hemisphere and give blood there. Now, the posterior communicating artery is not always there. So circle of Willis, which it is practically what you see here, is not always a circle. And it gets even more complex. Some people, almost both anterior cerebral arteries are supported by one side or another. And as a matter of fact, it is extremely rare that both of them are equally strong. So some people are supported by one side more than the other. And as well, the posterior communicating artery, we will come back to that, connect to, obviously, as you see here, the posterior cerebral artery, which is then supported by basilar artery, which is the two vertebral artery coming together. Okay, we will look at that now. Have this in mind. Let's now go look at the here. Now, I'm going to ask you now, what is this right here? Who want to sell that? Tell us.
I think Nader wants to take it.
Maliha, maybe you should help us here a little. So
Is that the basilar artery?
correct, and you see how big it is, right?
Mm-hmm.
It is a major artery. And then in the front of the basilar artery, you see that calcification there. What do you think what that is?
Well, we know that's the split.
plaque?
Go ahead.
Sorry, Neil.
No, you go for it. Sorry.
Is it like a plaque?
Yeah, it is a plaque. It's a calcification. What is that there? That, you know, this is not a schematic. This is actually a patient with a anatomical structure there. What is in that location that can cause calcification in that manner? What do you think? What do you think what that is?
That is where the bifurcation is at. So we know that that area is under a lot of stress with the velocity of blood flow. So that's where a plaque is more
No,
likely.
that is not within our vascular structure.
Is that the pineal gland?
Yeah, pineal gland would be a little probably higher. Could be. I mean, one cut, never make a decision based on one cut. But there are two things there that can do that. Pineal gland now would be a little too low for that. But another thing that is there is the fourth ventricle. My bet would be fourth ventricle. That is the calcification of what is in the lateral and fourth ventricle that can, what structure that produce the CSF?
Choroid plexus.
Yeah.
Choroid plexus. And choroid plexus, when we get older, can calcify. And we have choroid plexus in the lateral ventricle and the fourth ventricle. And that most likely, from the location, look at that, almost you see the small little darker area there, okay? So just because it is in the vicinity doesn't need to be connected or part of it, okay? Take that from this. Now, Let's go back to our schematic here. So basilar artery comes in here. Let's look at this one. We have two vertebral arteries coming from the back of the neck. And I'm going to go back and maybe show it to you. They come together, they become the so-called basilar artery. At your stage, you don't need to know the name of all the different things that are going on. And you remember we talked about that as well. There are almost 7, they are not even visualized here. Vessels that go away from the carotid artery, even before it gives you those things that you're, the most important thing is the ophthalmic artery. It's important because if you don't take care of it when you are doing surgery there, people go blind, okay? But here in the posterior circulation, you see as well lots of different arteries. There are 3 arteries though that is important to know. Actually 4. Now, one of them is the so-called anterior spinal artery. It's important because you can literally be paralyzed if there's any damage to this artery. And then we have to so-called pica or posterior inferior, we abbreviate them. In neurosurgery, we abbreviate them. We call that posterior inferior cerebral arteries or pica. That's a very important artery, gives lots of blood to very important structure in our brain. Then we have anterior ICA, anterior inferior cerebral artery. And then we have posterior superior cerebral artery, as you see here, okay? And then the major vessel as well is the posterior cerebral artery. Now, what's important? Important is that everything down to here is below the tentorium, give blood to your cerebellum and pons and vital structure. Everything here, posterior cerebral artery, as middle cerebral artery and anterior cerebral artery, they are supratentorial. They give blood to your cerebrum, not to your cerebellum. Does that make sense so far? There are 3 major vessels that gives blood to your brain. What we call cerebrum, the big brain, anterior, middle, and posterior cerebral artery. And there are actually as well 3 that they give blood to your cerebellum and pons and medulla and those area of the brain that are very important to your survival. We call them pica, ICA, and SCA. That's how we call them. And it makes sense that they are much, much smaller than the vessel that give blood to your cerebrum, correct? Now, what I think it's important for you guys to know is, again, knowing the circle of Willis. That is, I think, almost no matter at what level you are, that's a part of basic information you need to know. But what you need to know that it's actually not very common that it is a full circle. Now let's look at our patient here. Is that a full circle? It surprisingly seems to be not a full circle at all. Look at that here. You see that there? This is not what you think. This is not the communicating artery. Do you see that there? Neither this. It seems that the posterior communicating artery is very poorly actually built. Here is the circle of Willis, is not very well built. And so coming back to that, we see here the anterior cerebral artery, the carotid, internal carotid coming in, middle cerebral artery going back here. You see the posterior cerebrals taking off. And most of the other vessels that we talked about, you don't see that because they are below this plane. Is there any question regarding this before I go to some other pictures?
My first question is, you said that there's calcification of the 4th ventricle. What is the reasoning, or what is the etiology of 4th ventricle getting calcified?
Yeah, pineal gland, the same reason that your arteries, your aorta, and so on get calcified. It is just it is not a vascular thing, or it is vascular. I mean, obviously, the choroid plexus is a vascular structure,
Mhm.
but it's not an arterial kind of thing. It is a plexus of vessels that with time, we don't really know what the etiology is, but we know it's a part of normal. Now, if a 14-year-old has that, then we would be concerned about some autoimmune disease, some vasculopathy, and so on. But in my age, probably everybody in my age group has vascularization of the choroid plexus and pineal gland. Okay, these are the two structures that having vascularization is a normal in the brain. Anywhere else would be not physiologic.
Okay.
So this is now a beautiful picture. Now, let me make it bigger. And Neil, you want to take a first shot at this? Now, I'm going to, this is actually a little more difficult because you have arterial and venous structure in the same picture. So it's a little more complex. I gave you a freebie. This is not just the arteries, okay? So what is this, right? Where is my cursor? What is that?
Is this the basilar artery?
Correct.
It's right in front of
That is the basilar artery. And now, do you see that the posterior communicating arteries are very rudimental at best? There is no white thing going from the anterior circulation to posterior circulation. There isn't. Or do you see that?
I do not see it in this view.
Yeah, probably there is some, but it's not prominent enough for the thing there to see that, okay? Now, do you remember that we saw some calcification anterior to the basilar artery? Why don't we see it here? This is, by the way, this is not it. This is pineal gland.
Okay.
Okay,
Well,
so now let's look at that one more time. This here is not this here. Let's go back and forth. This actually, you know, we're looking at it that way. Let's go back here. That is actually your, yeah, that is actually, you're right. This is not basilar artery. That is, the basilar artery is farther down here. We don't see it. Yeah, you see that there? It got me as well, because this is supposed to be a cerebral angiogram, CT angiogram, but they delayed that. You see the venous phase. That is, you remember I said never make a decision based on one picture. So this is not basilar artery, because anterior to basilar, or in proximity of the basilar artery, you would see the fourth ventricle. Let's go back here. Here you see the third and fourth ventricle. So here, go back here. So this is the pineal gland, and this is not, but this is not basilar artery. This is the venous part. We come back to that. Let's forget about that. But here, this is the basilar artery, which is in the proximity of the fourth ventricle and where the aqueducts are. But so here is the basilar artery, and the anterior and posterior communicating arteries are very rudimentary. So Neil, what is that?
so would this be like the anterior, the ACA?
No, where my cross is. Let me make it bigger.
Okay.
Do you see where my cursor is?
I do.
So
then that would be the internal carotid.
correct. Then by definition, if that's internal carotid, then we have here the a vessel that gives a lot of blood to
So this would be the MCA, if that's the internal carotid.
Yes, that's the MCA. And then it would be probably, this is one side. This is not exactly midline. So this would be MCA and ACA on one side. Okay. Now, this is again a little deceiving because they delayed that. The cerebral angiogram, you get it as such that you get only the arterial phase. Here you see arterial and venous phase, and that is what it's really confusing. and that so-called straight sinus and so on. But let's come back to the venous phase later. Let me go back now a little here. This is higher up. This is higher up. Maliha, do you want to tell us higher up in the midline, front midline, what artery do you expect there to be? Front and midline.
Probably the ACA,
Correct. And on the side, what do
MCA.
MCA, yes. And in the back and literally radiating, that then is the posterior one, correct?
Yeah, I think so.
Now, so you know, the most of the midline and very, very anterior is supported by the anterior. The vast 70% of our brain is actually supported by the middle cerebral artery. So that the stroke of that region are always the more severe kind of strokes. So, but here you see mostly the peripheral phase, and then you see blood is coming back to go to the venous phase. Yeah, this is not the best one because it has venous and arterial phase. A little confusing, but so here, again, we come back to that. So you here you see what do you see here, Maliha? What are these calcification?
Of the choroid plexus.
Correct. And here it would be the pineal gland. That is the location for the pineal gland. This is
How do you differentiate that between just more calcifications of the choroid plexus?
well, choroid plexus is where the ventricles are. And
Right.
Lateral ventricles, and the lateral ventricles, they're connected, but you don't ever see them connected in one cut. So you see the posterior horn, you see the temporal horn farther down, and you see the anterior horn here.
Okay.
They come together, they become the third ventricle, and then you have the aqueduct, then it goes to the fourth ventricle. Now, if you want, I can as well, show a brain ventricles here. Let me show you in this picture. So you have the so-called temporal horn, anterior horn, and then no, that's not a good picture. Let me get another picture that maybe visualize it a little better here. Maybe that is a little better. Okay. You guys are able to see that? So you see, that is the reason you cannot see all the ventricle in one CT cuts, because it's a three-dimensional kind of structure. But it goes along the, posterior horn, anterior horn, temporal horn. They come together in the anterior horn, and they become the third ventricle. By the way, third ventricle, it is like a donut. Now, it's not always, but often it's like a donut. Who knows? Okay, you get a bonus. Why third ventricle is not a ball, it's more like a donut.
Does this have to do with embryology, such as like the diencephalon or the way that it is forming in the embryo?
Yeah, it always has, everything has to do with embryology. That is how a brain is formed. But there is a structure. See, third ventricle, so the two lateral ventricles come together, they flow to the third ventricle. The third ventricle by itself should be like a ball, like a
collection.
But it is not, because on both sides of the brain, two things, they push from the side, they touch each other in the middle and make a sphere to a donut. What is that? Make the sphere in the donut. Okay, don't worry about that. We call that.
Is it the thalamine?
It is part of the thalamic or midbrain structure. We call that, it's not thalamus itself, but we call that nucleus accumbens septi. But meaning that
nucleus accumbens septum?
Septi. Nucleus accumbens septi, because there are two of it on each side, part of very close to thalamus, and it comes from both sides, pushes in the third ventricle, they touch each other, And that's why we call this a compass septum. The nuclei that touch each other in the make a septum in the middle. Okay, don't worry about that. It's maybe a little for your future.
Heard of the nucleus accumbens, but not the
Right.
septi.
Yeah, well, that is the nucleus accumbens. They touch each other in the septum. Septum is the wall between them. Okay, and that is why it look like not often, but not all the time, but often look like a donut. And then you have the aqueduct, and then you have the fourth ventricle. Now, the the basilar artery is somewhere here. You see, where I was saying that the basilar artery is in the vicinity of the fourth ventricle.
Right.
That is why, and in the back of the completely back of the third ventricle is where you usually see the pineal gland. Okay, let's go back here. Okay, so this are the, and by the way, this is the, when you go further down, that is where these two structures, they touch each other and make that sphere, which is the third ventricle, to a donut. Okay. Well, any question regarding this? Okay, let's look at this one here. Let's start with things that make sense to you. Nadir, you want to take a shot at this one? Now, what is the structure in this big hole here? It is the back of the brain and further down. You see barely any of the temporal horns of the brain. So
is it the cerebellum?
Cerebellum, exactly. That's exactly what it is, cerebellum there. Now, if you look carefully, you see there are these dots, meaning this is an angiogram. They gave some contrast because you see these white things coming across. Now, all of a sudden, under the skull, you see this blood here. Why am I not concerned about the bleeding like a subdural hematoma? What structure is there that is normal to have blood?
The sinuses?
Sinuses, exactly. They are big structure that take the blood back from our brain back to our heart. Now, do you know what is specifically which sinus it is?
The transverse sinus that's under the
Perfect.
cerebellum?
Very good. Exactly. That's the transverse sinus. Now I'm going to show you some of the, let's look at some structures there. And then I will come back and interpret that. Okay, here. Are you guys able to see that? Forget about the complexity of that. Let's just make it easy. There are two major structures that collect the blood from our brain, superior and inferior sagittal sinus. Okay, so obviously this is the so-called the superior sagittal sinus that comes back and connect to so-called transverse sinuses, and then it becomes like a sigma. That's why we called it sigmoid sinus, and then it becomes literally the major vein that take the blood out of our brain, and by looking at that, now let me get maybe a different picture. I want to show you. Yeah, that is a much better picture. So okay, this is back of the brain. This is the front of the brain. This is up. This is down. We talked about the superior sagittal sinus when we talked about the inferior sagittal sinus. That practically they are in the middle of our brain and take the blood from both hemispheres. The inferior sagittal sinus connect to the so-called straight sinus, and this where the superior sagittal sinus and the blood from inferior sagittal sinus through straight sinus come together, then the blood goes in both so-called transverse sinus, and then you see why sigmoid sinus is called sigmoid sinus. You see that there? Now, there is an important structure there, and that is the extra bonus. The blood of our midbrain comes from so-called vein of Galen. Have you guys heard of that? Vein of Galen here. This is the inferior sagittal sinus, and the vein of Galen. They come together, they make the straight sinus, and then they go to the so-called transverse sinus. So the flow of the blood is from here, and from here, and from here, become straight sinus, they come here, and then they flow in both directions. They go to the sagittal sinus and they go down out of our skull. Now, important of the vein of Galen is our midbrain, or most of our very vital structure, including thalamus and so on, the blood returns through the vein of Galen down here. Now, I want to go back now and I want to show you a structure in actual here. So we just talked about that. What do you think what this is? This straight structure is?
Straight sinus.
Straight sinus. And then that would make this the vein of Galen and internal cerebral veins and so on. And that is the pineal gland. So here you see that, and here, up here, Nadir, do you know what this is? We just talked about that.
Is that the superior sagittal sinus?
Correct, superior sagittal sinus. Now, it is not fair because, you don't see the inferior sagittal sinus. This is a mix of arterial and the venous phase. It is really a little sloppy because you don't want to mix them. It's, the way they do that, they give contrast. Within 3 to 5 seconds, they get a picture, which is an arterial phase. Then they get within 7 to 12 second picture, which is then the venous phase. That is how long it takes the blood to go from the, if they give a contrast. So they got it somewhere between, and you get each of it. So it's not the perfect picture. So let's go back here. I want to show you a few other pictures. Now, Maliha, or let's go to Yanal. Yanal, can you tell me why it is, what is this here and why you don't have it on the other side?
Yeah,
I'm actually not sure. Yeah, I'm an undergrad. I don't know too much about like veins or the anatomy or anything.
No, but okay. Neil, do you want to take on that? What is this?
Well, I mean, is this the same patient as earlier? Is this
Yes, it is all
possible
same patient. It's all same patient.
calcification of this lateral ventricle?
Correct, and calcification of the choroid plexus.
Mm-hmm.
Why don't you have it on the other side?
Well, doesn't necessarily mean it doesn't exist on the other side. It could only have been formed on that side. It could also mean maybe, like you said, never diagnosed like on one view. So maybe our view is just wrong. Maybe we need to go a little bit deeper or a little bit more superficial or change the view.
It is, yes, no, never diagnose it on one side. And by the way, it is nothing unusual for that to be asymmetric. It's nothing unusual.
Is it just like something to do with like differing patients have like certain dominant flows of their sinuses or something like that?
The patients have always different dominant flows, and that is a normal thing. But as well, they can have dominant flow on one side, but calcification on the other side, and so on. There is really nothing correlates that. So asymmetry is part of our biology. Okay, so don't ever expect things to be symmetrical in our anatomy. Okay, so I'm looking at that here. Let's go another picture now. Okay, this should be easy to say what this is. What do you guys think what this is here? This calcification here.
That's the pineal gland, right?
Correct. And now that you answered that, tell me, what is here, right here? Are you able to see where I am?
Pituitary,
Yes, that is called, what is this bone called?
the sella.
Sella turcica, exactly. And then we are midline. How do I know we are midline?
We
Because
see corpus callosum.
we have corpus callosum, exactly. We have the sella turcica, and we have the fourth ventricle. This is a perfect midline picture. And now you see obviously the sulci and gyri and so on, correct? And here you don't see the sulci and gyri because that is corpus callosum. Okay? And then I just gave it away. What is this?
Fourth ventricle.
Fourth ventricle. Is that the lateral ventricle? You just said it's midline, right?
It is midline.
So it cannot be lateral ventricle. It has to be part of the third ventricle.
Mhm.
Because lateral ventricle, you shouldn't be able to see it in the midline cut.
Mhm.
Okay? Okay. Now, but you do see a little bit of a whitish thing here because by the way, what is the structure that I'm running the cursor on? What is that?
Like the tentorium.
Tentorium.
Correct. That's tentorium. And you see a little whitish here because you see part of the superior sagittal sinus. And then this is a little more advanced that if you do surgery, I go through the nose, I take this off, I go through here, I take this bone off, and then I have access, I can do nasal pituitary surgery.
So is that the sphenoid bone? The one that's
That is the sphenoid sinus and bone
sphenoid sinus.
that I have to take off. Transsphenoidal. That's why we call that transsphenoidal
Mhm.
pituitary surgery. Okay? So you see a lot of things interacting here. So this is a boring picture, but here you see the lateral ventricles higher up. That's why you see that if you go farther down, this structure and this structure, they separate. Okay. Now, obviously here we see again the pineal area, and this is interesting here. What is the structure right here? Do you see that the sulci and gyri, they have different orientation here? Neil, do you see that?
I do.
Here you see the bottom part of the temporal horn, and you see the sulci and gyri. All of a sudden, you see the direction of the sulci and gyri, I put apostrophes there, are different here.
Right.
What do you think what this is?
Is this possibly the brainstem or like the medulla?
No. What comes before that?
Like the cerebellum or
Cerebellum. Yes. And in cerebellum, we don't call it sulci and gyri. We call them foliae, correct?
Foliae.
Foliae. These are cerebellar foliae, whereas here are temporal horn and some of the posterior sulci and gyri, posterior lobe. Okay.
So would that possibly be the fourth ventricle in front of the cerebellum?
Yes,
Or-
that's exactly what it is.
Mhm.
Yeah. Okay, now you see that thing here. What is this? And why is it so big?
Is that the lateral ventricle?
No,
this has to be this is a sulcus.
a big one.
Yeah.
A big, that's something that separates the frontal and temporal horn. What separates frontal and temporal horn?
I'm trying to remember the name of it.
Is that the lateral fissure?
Well, we call that the Sylvian fissure.
Sylvian fissure.
Okay, this is what right here. But the question is, why is it so big? Let me go back there. Why is it so humongous? Because this is an elderly patient with brain atrophy. In the other picture, we see as well, you see a lots of empty spaces there. When we get older, our brain shrinks, but our skull doesn't. Here, you see the Sylvian fissure. Now you see the
Enlargement of the lateral.
Yeah, the lateral ventricle. You see this in your age, if I would get a CAT scan of you guys, you wouldn't see all these empty spaces. Hopefully not.
Yeah, you're stimulating our brains a little too
Yeah.
much for for the atrophy.
So, and here again, you see the Sylvian fissure and the lateral ventricles.
Is the Sylvian fissure also called the lateral fissure? Is that the same one?
Yes, it is. You know, some people call it that way. We neurosurgeon, we just call it Sylvian fissure.
Okay.
Now, you remember we talked about that? That structure that I have to take the bone off to go to the pituitary?
Mm-hmm.
What was that?
Sphenoid bone.
That here it is again. Now, let's come back to that now. We talked about the basilar artery, the posterior communicating artery are not well built. You see the anterior circulation, you see the straight sinus, you see part of the sagittal sinus, you see the vein of Galen, and the middle cerebral artery is somewhere here, right here, I believe, right here. Okay, now let's go back. I'm gonna go outside of the skull now. Let's start with, should we go over this? I mean, Neil, do you want to just tell me what this is right here?
Well, is that the hyoid bone right in front of it? Is that?
It's way too high to be hyoid bone. Hyoid bone, look at that. This is the,
Oh, I'm seeing that. So is this sphenoid?
no, way too low. Lower, much lower than that. This is the odontoid, the part of the second vertebra in our spine. And this is our first vertebrae, and this is the odontoid.
Okay.
Okay, so let's go down here. Now let's look at that. Now let's look at that. Unfortunately, this is just a picture. I cannot change the density and show it to you. But there is this vessel here, comes here around C, bypass the C7 and around the C6, enters almost to the side of our vertebral body. What is that?
Is this the vertebral artery?
Correct. That's exactly what it is. You don't see it here well, but if you just follow it up, unfortunately, this is a picture, not the DICOM. In the DICOM, I could have changed the windowing and show it to you.
Mm-hmm.
But it goes here. It does not goes to the intervertebral foramen of the C7, even though we have a hole there, but it doesn't usually go there. It goes to C6, goes up here, and then goes up, make a huge kind of turn, and then enter the brain in the back, and then becomes basilar artery, okay? And here on the other side, you see the carotid. Again, carotid bulb, and so on and so forth. You see that
And
here. So,
I see that, isn't it the left vertebral comes directly off of the aortic arch, but the right one will come off the brachiocephalic trunk?
and it makes sense, right? Because the aorta turns to left,
Mm-hmm.
correct? And then you have the brachiocephalus go to the right, and then it takes,
Acts as a supportive bridge for them to branch
Right.
off.
correct. Okay. So here, that is now we can come back to this again. Here, you have the, and if you want, you can actually see that here on the left side, it comes directly from the aorta, and on the right side, it takes off from another bigger vessel. Okay?
Mhm.
Now, this is actually not much else we can see from that, except you see the vascularization of the lung, you see the ribs, you see the clavicle, and so on. And then, okay, I would say we sort of watched everything that we can see here.
Mhm.
But let's go a little, now that we have talked about all of that, should we go a little look at the schematic of it on like a cartoonish picture there and see, okay, here, you remember here, we talked about that,
Mhm.
that this is the vein of Galen and straight sinus, and that is the arterial and venous things are mixed with each other. And that is the circle of Willis here, middle cerebral. Let's see what else is here. That's not really anything. Okay, that is as well. I think we can talk just a little about that. Again, the carotid comes in and then gives to the anterior and middle cerebral artery, and the communicating artery is here in the front. And then underneath, it's really, I cannot really show you by changing the windowing of this, but somewhere here is in that area is the hole that the carotid turns around through the bone, comes in. So let's go look at some actually arterial visualization of that in a little schematic way. You remember we talked about the anterior internal carotid coming in, posterior coming in, and then they all communicate through the middle cerebral artery. What if I told you that I have seen a lot of patients that from these 4 arteries, only one of them is a patent and giving blood to the brain, and they are just like you and I, they just function just fine. Happens a lot actually. Okay. Now, if there is actually the rule of thumb that if you completely close one of the carotid, only in 20% of the cases you get a stroke. Well, you would be surprised because you would expect everybody, you close the carotid artery, you would get a stroke. But only 20%, 1 in 5 person would get a stroke, because in other 80% of the people, the vascularization around the circle of Willis is enough to keep the blood still flowing. Okay. Now, just want to show you maybe 2 more things. Now, why is the basilar artery is so important, for more important, like you see people, when the people talk about having a stroke, they're usually talking about the middle cerebral artery because it's 70% of the vascularization. But we have another big vessel, the basilar artery. You barely hear about basilar stroke. Why is that?
Well, is this where you can have a pontine hemorrhage?
Well, you can have pontine hemorrhage or stroke, but
Because of the basilar artery?
let's say you go to hospital, they say somebody has a stroke. 70% of the time it is middle cerebral.
Correct.
And almost 29% of the other time it is anterior posterior. But you barely ever see basilar stroke. Why is that?
Is it because it has a really high mortality? Like with
Yes, they don't make it to hospital.
Yeah.
Work, okay? That is exactly what the reason is. Because those structures that it gives blood to, they are so vital, so extraordinarily important, they don't make it. So here you see another schematic of it, that how they come together and where they take off. And we talked about that, that the left side comes from aorta directly, but the right side comes from the brachiocephalic artery and so on. So I think we sort of covered it all. Do you guys have any question? Anything else you want to know? No? Okay. Then I think we can just conclude this. Actually, you see even somebody who's a neurosurgeon, the rule is, first of all, don't look for symmetry. Second, never ever make a diagnostic from one picture. And even at my state, people do that, and there are 9 out of 10 times that they are led to the wrong path. If you just you look at one picture and try to make a diagnostic. And then more importantly as well is that you know that if you see a stroke, most of the time it is going to middle cerebral artery, okay? So, and you look for symptoms of the middle cerebral artery. What you do see, like partial cerebellar stroke, if there's but that is usually happens if there's an embolus from somewhere else, for open patent from an ovale or something like that, or those are extraordinary circumstances.
Right.
The way
Like the left atrial appendage, AFib. those things that can.
Exactly. Now, by the way, if you have a let's say stroke, there are two kind of strokes, right? Two kind of. What do you? Nader, do you know what kind of two different kind of strokes we have in our brain?
Is it one of them is ischemic?
Correct. Absolutely. And the other one is
Hemorrhage?
hemorrhagic. So hemorrhagic or ischemic stroke. What percentages do you guess? Just guess. What percentage is one versus another?
Is hemorrhage less common?
Yes, it is true.
Okay.
Absolutely. Do you want to throw a number out there? Let everybody throw a number out there, and
Maybe
then I tell you what it is.
80-20?
80-20. We have 80-20. What else do we have?
I'll say 90% ischemic, 10% hemorrhagic.
90-10. What else do we have?
Like 95-5.
Okay, we are going 95-5. Anything else?
85-15.
Yeah, well, about 70-30. About 70-30. About. Okay. 70% ischemic. So if in question, obviously you always have to get a CAT scan. Okay. But most of the time it's ischemic, and 70% ischemic, and but in question, as a matter of fact, not in question, always get a CAT scan, because then you see the blood, and then you do not give them a thrombolytic agent, correct? Okay. But that is why for all stroke is protocol is to get an early CT. Why not MRI? Why not MRI?
It takes too long.
No, yeah, well, it used to be very long, but that's not the primary reason. The MRI is not the primary diagnostic for after the stroke. The primary, they hit the ER, you get a CAT scan, not an MRI. You get MRI later, but you get a CAT scan right away. It's faster, yes, but that's not the real reason.
Because we want to visualize if there was what type of stroke was it? Was it hemorrhagic or not? Whereas an MRI will give us more detail within the soft tissue, what areas would have been infarcted. Whereas the CT, since it is faster, it won't be as detailed as the MRI, but it'll tell us what we need to know.
No, CT is much better to show you early blood. Blood is always white in the CT. Whereas MRI, depending on the age of the blood could be white or dark, depending on the sequence. It could be interpretation of the acute blood is much, much harder in the MRI. So you cannot say for sure if it's blood there or ischemic and so on and so forth, because sometimes in different age of the blood, the MRI signals behave differently. Okay, so CT, stroke, CT. Okay, that should be your take home. Later MRI, but stroke, ER, CT. Okay? Okay. Guys, it was fun for me. I hope it was fun for you. And now that we actually, we should, next time maybe somebody should come and present a case that we can dissect together, okay? Let's make the next case truly a clinical case presentation and investigation, okay?
That sounds good. Yeah, this was a nice change from spine. So
Yes. Okay, guys, then you guys have a great weekend, okay?
okay.
Thanks,
Thank you so
Dr.
much.
Bhatia.
Yeah, you too.
Thanks, Dr.